Hi, welcome to this week's whiteboard session. I tried to do this earlier this week, but there were some technical difficulties, so we're going to try this again. We're going to try to make it a little bit shorter as we're going through. What I've realized as I was talking over the past couple of weeks was that there is a need for patients to have a better idea of what they should be expecting and receiving from their practitioners. And I didn't realize that because I admit I've been very lucky. The people who I have seen for my own care and the practitioners with whom I've worked alongside do a very good job of the couple of things that I'm going to talk about. And I've worked hard to emulate that. I didn't take into account that there are patients who go to see them, clients who come to see me, who don't realize that that's how care should happen. And there was a message that was sent in recently from a client who we work with here at the gym, the coaches and myself work with, who lives out of state. And I realized that there are a number of times that clients from across the country write into us because they work with us online, asking, how can we find a practitioner? How can we find a coach? How can we find a gym? How can we find XYZ? What do we look for? How do we figure that out? And this is an opportunity to help people understand, help clients, future patients understand what they should be looking for from a practitioner and what kind of care they should be receiving. Now, this is not a standard format that it has to happen in this way, because you could take the information that I'm about to give you and a practitioner will be able to look at that, whether that's physical therapy, it's chiropractic, it's massage, it's athletic training, and they're going to be able to say, okay, I do that, but I do it in my own way, this way. But as long as the boxes are checked, that's what's important. And it's educating clients and patients on what those boxes are. So we're going to start off with this. When someone comes to see me, one of the first things that I want to be able to do with them is to help them understand why they have an injury, not just what the injury is. And often there are a number of influences that go along with that injury. Whether we're talking about a lack of education on the movement, whether we're talking about an inability to have proper movement, they have limited mobility in an area, they have limited strength in an area, a combination of the two. There are usually a handful of factors that come together that result in the injury that they are experiencing on why they're coming to see me. I want them to understand that. I want to be able to understand that because that's going to influence my ability to help them and what I'm going to be doing with their plan of care. But before I get to that plan of care, before I'm able to explain to them why these things may have happened, I'm going to go through a process of assessing. I want to test, I want to do some initial treatment on that injury, I want to reassess, and then I'm going to develop a plan of care, because in the process of doing that, I'm also going to realize that aside from the influences that culminated into injury A, there are likely other compensatory, secondary, tertiary injuries that are going on, which I just labeled B, C, and D. If someone comes to me and they have back pain, more than likely it's not just back pain. It is being experienced to the highest degree in the back, but there are probably a number of other areas that are being affected because the body is amazingly adaptive and it can compensate like nothing else. So what it does is begins to shift the load to other areas in order for you to be able to continue doing whatever activity or exercise or training that you're doing until it ends up overloading one particular system more than the others. But if you have back pain, there's probably also issues going on other places. You could have hamstring issues, you could have hip issues, you could have things going on with your ankles, with your feet even, that are all, in a sense, injuries, but are being experienced collectively as back pain. You want to find out all of those to help out. Because once you've gone through the assessment, the testing, the treatment, the reassessment, the developing the plan of care, you're going to move into these different phases. Now you may have more phases than this, you may have less phases than this, depending on what you're working on. But each phase is going to focus on treating essentially one part of what's going on. We're going to focus on that one area to help calm that area down. And then when that's under control, we're going to move on. So we're going to have this opportunity to treat injury A. And when that is fairly under control, we're going to have maintenance on part A and then move to treating part B. And then phase 3 is we're going to have maintenance on A and B, and we're going to treat C. Now, it doesn't have to be that cut and dry as you're going through. If you can multitask and do multiple areas at once, absolutely do that. But the point is that you should be able to explain to the client or patient how you're going to go through that. We're going to back up for 1 second because there's a very important note. If you ever go to somebody and they can't give you a fairly definitive answer on how many sessions they're going to need and how much they're going to be able to help you in that number of sessions, leave. No offense to those practitioners, and that doesn't mean that they're bad at what they do or that they're trying to cheat you out of money. But that does give you an idea of how familiar they are with you and your particular activity. And that's why I like to say this before we move on anymore, because working within the sports or athletic realm, you need to have someone who understands what your body is going through in a multitude of factors. I work with a number of powerlifters, Olympic weightlifters, swimmers, and gymnasts. You need to understand not just the movements that they're doing, not just squat, bench, and deadlift, not just the clean and jerk and the snatch, not just the difference in the 100-meter versus the 1 mile for swimming or the different events in gymnastics. You need to understand how does the body differ when they're going through prep versus going through the off season or a volume phase. How does it differ when someone's been doing this for 15 to 20 years, and what is their total, what is their weight class versus someone who's been powerlifting now for only 2 years. They have a different total, they have a different weight class, also male, female. All that kind of stuff has to be able to be understood so it can be taken into account and therefore used for the plan of care and then communicated to the athlete. All of that is crucial. And if you're working with someone who says, hey, I'm going to need to see you multiple times a week for multiple weeks before we get this under control, I would recommend getting a second opinion. That's not to speak for that particular practitioner, but that's been my experience. Once we have all of that under control, we're moving into a full maintenance routine. You should be able to have them coming in as, say, once every 4 to 6 weeks. We're going to get things under control. We're going to assess, we're going to recheck in with the client or the athlete or the patient, and we're going to let them know what we're finding as professionals and get them under control. That way, if anything does flare up, if anything new arises, we're on top of it just like that. Because we've got such a good foundation of everything else being taken care of, that taking care of something that comes up can be done very quickly. When that new injury or new issue arises with all these other things still being taken care of, it's a little harder. Not overly difficult, but harder. And you want this to be as simple as possible for the athlete. So things that should already be included. You should have movement corrections for the individual with every single phase. You're not just having them come in and be like, well, I'm going to work on your low back now, see you in a couple of weeks. No, you're giving them work in order to help them to fix what it is. Now that movement correction, that could be working on breathing, that could be working on mobility, that could be working on body awareness, that could be working on the actual technique of the lift itself. It could be all kinds of things. But each of these should have some level of emphasis. And that's why the plan of care is so important, because you can backtrack it and say, where should they be when they get to full maintenance? Where are they right now? How can I break that down into the different phases and help them? And if you're with a practitioner who, one, isn't doing that with it, you as an athlete or as a client should be asking them for that. And if they can't do that, that's another indication you need to try to find a practitioner who's able to not only do that for you, but really communicate and educate. Those are key elements. The next part, again, communication, but with the coaches. There needs to be a level of communication between you as the client and athlete, the practitioner, and the coach, because there is a level of translation that happens within the verbiage between all three of you. And if they have multiple coaches, well, you have multiple conversations. This is the high level of customer service and client service that we need to be able to offer as practitioners, and the athlete should be able to expect. Because if I say, hey, I need them to make sure that they don't overload this particular area of the body, and I tell that to the athlete is then responsible of taking that to the coach, and if they don't do a good job, because now you're playing the game of telephone, the coach may not be able to accommodate that. But if you're talking to the coach and the athlete and you say, hey, I need them to be able to decrease how much volume and how much load they're going through here, and these are the things that I'm seeing, can you watch for this? The coach knows what the programming is and can then translate that to how they're going to adjust the programming for the athlete's ongoing care outside of the work that the practitioner is doing. It creates a much better level of care and customer service. The next part is the education on self-care. I'm going to see somebody at most once a week, more than likely once a month. Maybe somewhere in between, depending on how much they're able to come in for their own schedule and their own financial resources. I need to be able to educate them on how to do things for themselves. How do they take care of themselves? How do they learn breathing? How often do they practice it? What should be the goals that are associated with it? How do they work on mobility? How often? How does that integrate with their current programming? We got to put all those pieces together. That involves really good education. Athletes, if you're not getting that, ask for it. If you're asking for it and still not getting it, look elsewhere. The last part up here, and by all means this is not all inclusive, but this is how I definitely go about working with my athletes. These are some of the key elements, is the adaptability for the plan of care, because within that we have to be looking at what other treatments are they doing, what is their schedule, that could be their life schedule, their training schedule, how often they're able to come in to see you, what their schedule is like as far as who else they're seeing, and then what are their goals. We have to be able to take all those things together and create a malleable plan of care that we know is going to be the best that we can do, but also flexible, because life happens. And if you have a practitioner who's just cut and dry, like, this is it, this is the only way to do it, get a second opinion. Now, yes, there is very likely a best plan of care or the ideal plan of care, but we don't live in an ideal world. So there needs to be some leniency with that. However, the leniency has to come with a conversation in which athletes, you should be having this explained to you that, look, if you want the best outcome, this is how you have to do it, and if this is what you're asking for, I can kind of meet you halfway, but these are going to be the change in results. Conversation and communication and understanding what should be communicated within those conversations is absolutely critical. Now that's a responsibility not only of the practitioner, but also the client, or the patient, or the athlete. If you're not doing that, you can't really expect it that much better from the practitioner. However, if you're doing your job and you're still not receiving it, that should be a standard of care that you should be looking for, and you should understand that that conversation, that communication should be to the level that you need it to be for your event and for you as an individual. That's what I want you to look for. If you're not receiving it, ask for it. And if you ask for it and you're not receiving it still, find someone elsewhere. We can continue talking about this in the future going through, but I felt this was absolutely critical to begin a conversation about. So I hope that that helps.